So we're here today at Barts and the London Medical School, and I'm going to be chatting to Ruth all about DMTs during pregnancy. So Ruth, are DMTs safe to be on when you are trying to conceive?
So it really depends on the DMT actually. Some DMTs aren't safe to be on when you're trying to conceive, such as Gilenya or fingolimod, and these need to be stopped at least a couple of months before you start trying to conceive. Others are safe to continue while you try to conceive, and some are safe to use during pregnancy as well. So it's really important that you have that discussion and you have it before you start trying to conceive.
Yeah, I know that for me that was a huge factor in deciding my treatment, because I'm at that family planning stage of life, so I chose Tysabri, which is pregnancy safe. So I'm really glad I made that decision.
Yeah, and I think that, switching DMT can be a really anxious time, it can be really tricky.
Yeah.
So actually making that decision, sort of taking pregnancy and family planning into context really early is important, because actually that might help to avoid a switch a couple of years down the line.
Definitely, and just feeling like you have some control over the next few years and knowing what the plan is.
Exactly, and even if you're not sure what the plan's going to be, because we know that life changes, life gets in the way of everything, thinking, well, actually this is something that I don't then have to worry about before I start on my sort of conception journey is actually really helpful.
Definitely, I think with conception and fertility there's enough to worry about already, isn't there? So it's good to be informed about your treatment choices in advance.
Definitely.
And what about if someone gets pregnant unexpectedly on a DMT?
So a lot of that depends on what DMT you're on, obviously, and what you want to do about the pregnancy. I think that the first thing to say is it's really important to speak to your MS nurse or your MS team if this happens. Often people find their MS nurse as their first port of call, kind of practically, and to let them know. And also not to stop your DMT without having the discussion with your team about what's going to be the best thing for you, for your pregnancy, and that takes into account information, both about what you want to do, what your plans are, what you want to do going forward. So I think it's less of a knee-jerk reaction thinking, oh, I've got to come off all my medication, and more like, okay, we've got a few weeks, we can take stock of this, work out what's best for me, for the baby, for my family, for everything.
Yeah, absolutely. And if you do stop taking your treatment during pregnancy, then how soon after can you restart it again?
So that depends on a lot of things. It depends on what you're thinking about breastfeeding. It depends how breastfeeding actually goes in practice. It depends on what disease-modifying therapy you're thinking about restarting. Because actually some disease-modifying therapies are compatible with breastfeeding and you can do the two alongside each other. Others we would recommend that you don't restart until you've completed your breastfeeding journey. Okay. So there's lots of different things to weigh up. The other thing to remember is that some people may not want to go back onto the same DMT after pregnancy as they were on before. Maybe they're on something for pregnancy planning purposes and their family's now complete, and actually they're thinking about starting something different. So again, all these things need taking into account. In general, some people choose to start disease-modifying therapy really quickly after pregnancy, and often if they're doing this, they choose one that goes with breastfeeding, that can be done with breastfeeding, to at least be able to give breastfeeding a try, even though it doesn't work for everyone.
I know that postpartum relapse is quite a big worry for people as well. Does going back onto a DMT reduce the risk of a relapse postpartum?
So that makes sense, that idea, but actually we're not 100% sure. We know that breastfeeding actually appears to reduce the risk of postpartum relapse a little bit, although the information's quite complex to interpret because people who choose to breastfeed are often those who are at lower risk of relapse to begin with. In modern cohorts, in modern groups of people living with MS who have access to treatment, about 1 in 8 people have a relapse in the 3 months postpartum. So it's not as high as you might be worrying about. We don't know when the right time or when the best time to start DMT is, and that probably reflects the fact that it's different for everyone. So it's really important that you actually think about these questions whilst you're pregnant, discuss with your neurologist, and maybe have a couple of plans. Maybe think about, well, this is what I want to do if breastfeeding goes well, this is what I want to do if it's not working out so well, and also have a plan for what happens or what to do if you have a relapse. How do you seek help? What would you want to do about steroids, and what difference does that make to your choices around treatment? I think one really important thing to say is that some people worry actually about having epidurals or spinals and those increasing your chance of relapse, but that's not the case. There's the current evidence says that having an epidural or a spinal, if you have MS, is safe and it doesn't trigger a relapse.
Great, so I can have all the pain relief then.
Can have all the pain relief.
Deciding on a birth plan can be really, really challenging, so we'd love to know if anything helped you when preparing for yours. Please let us know in the comments below.